Hey everybody, welcome back to the channel. My name is Kelly Troutman. I am a certified hand therapist. Today's video is going to be a little bit different. So I have been making a lot of exercise videos lately, which is really cool. They've been kind of shorter videos, just showing you like an exercise or two for different diagnoses. And that's been pretty neat, but today I thought it would be fun to just kind of like catch up a little bit and do more of an informal kind of like vlog style video. So that's what we're doing today. And I thought, you know what, like I'm gonna be sitting, I'm gonna be talking. Why not give my hands like a spa day of their own? So, right? Because hand therapist on a 3-day weekend needs a little bit of a hand spa day, right? Yeah, all you hand therapists out there know what I'm talking about. So this is not sponsored, by the way. I just have these and I thought it would be fun to do while we're talking. These little hand masks. So yeah, it's a super hydrating hand mask for thirsty hands. I've been spending a lot of time like out in the sun, and I did like 100 loads of laundry today. So my hands are like feeling a little bit dry, you know? Not to mention with COVID, how much we're washing our hands all the time. So yeah, we're gonna do that. And I've had this mask for like probably 6 to 8 months, and I haven't used it because I can't sit still for a very long time without using my hands. It's the same reason that I never paint my nails too, because you know, your girl just can't sit still. Well, this is cute. Oh, it comes in like a fun little pattern. I love that. Oh my God. Wait, how does this work? Why does it look like this? What am I supposed to do? It's fine, everything's under control again. Let's put it on the right hand. Ooh, I don't love that. Ugh. It feels a little slimy, but I guess that's the point. Okay. And then you just, oh, okay, so it like fastens. Well, that's cute. Ooh, okay. Anyway, I don't know if I'm gonna be able to do both at the same time, but you know what? That's what it's intended for, so let's just go for it. Okay, now that I look like a gardener, let's talk. So, a couple weeks ago, kind of was brainstorming and trying to figure out how I was gonna progress this one specific patient that I had. So, little backstory, distal radius fracture, plated. He was then a volar plate, okay, casted for I think 3 weeks, and then the cast was removed and the surgeon put him in like a prefab wrist cock-up brace, whatever. He came to me about 5 weeks after his original surgery, just because the patient was like waiting to schedule. Basically, the surgeon told him to come to therapy, and then he like felt like he wasn't ready to start therapy. So he came to me super stiff, super swollen, a lot of like dorsal pitting kind of edema in the first visit, really stiff, could barely even move the fingers at all, having to like support the arm even just to lift it from a rested position on the ramp, like to be able to lift it up, he had to like support it, he was holding it everywhere. He actually came in wearing like a big sling contraption, so we're making a lot of progress, He was getting more movement. It was painful and stiff, but we were starting to get a little bit more. But he was having such a hard time getting the fingers down into a fist, and almost had just this weird pattern. You know when people have that weird pattern where they don't lead with the hook fist and they just immediately start curling? It's like they don't have any intrinsic like control, and they're so stiff in the tips of the fingers and the IP joints. So that's kind of the pattern that he was having. And I just kept thinking to myself, like, okay, what can this guy do? He's already doing a ton of passive stretching at home. you know, he's telling me that he's working, he's like keeping it rested in this passive position, stretching him out, but he just doesn't have that active intrinsic control. And so I had this like brain spark, I don't know, like just this eureka moment of like, wait a minute, like why don't I try like an active redirection relative motion orthosis with this guy and see if he wears that all day, if it will help him be able to like get the IP joints moving. So if you're not familiar with the concept of relative motion orthoses, it's a small piece of thermoplastic that you kind of weave in between the fingers, and essentially it blocks the MP joints from doing full movement, and it allows the force to be redirected. And so there's a lot of different purposes that you can use it for. But I decided, why not try it? Let's see how it goes. I'll see him in a few days and see if it's working. And you guys, it worked so well for him. I think the way that I put the relative motion on him was with the pinky and the index finger on top. And I believe that's the way that I made it for him. No, I might have actually done it the opposite way. Yeah, I did it this way with the index and the pinky on the bottom, and then the ring and the middle finger on top. And he immediately was able to like get a little bit more movement in the IP joints. I sent him home with it. I told him to wear it pretty much all day long, take it off when you go to sleep. And in a couple days later, he already had way better movement there. And he's been using that for a couple weeks, and we're starting to see some actual like real improvements. His pain is decreasing. He's able to like do more with the hand. So I just thought that was a good example of kind of thinking like outside of the box and thinking like, how can I help this person without necessarily giving them an hour's worth of exercises to do, but maybe something to help support them and to promote this movement occurring while they're going through their day, so that they don't necessarily have to have 2 hours of, you know, therapy exercises every day, because it's really hard for people to comply with that. You know, it's just hard for them to like, okay, now I'm gonna do my hour of therapy exercises. Like, we end up adding so many things onto them and we don't realize how long it actually takes them. So using a relative motion splint was a great idea for this particular patient, because he didn't have to think about it. You know, he was able to just go through his day, try and use the hand for light typing or kind of grasping some small objects, just trying to be able to use that hand as much as he could. And it really actually has been helping him a lot. So I just wanted to share that story with you guys, and see if you've ever used relative motion orthoses in your practice or for something similar. So definitely comment below if you have, or if you had any, you know, kind of eureka moments yourself, especially with somebody with stiff fingers, especially when it's all 5 fingers that are super stiff. You know, sometimes we just have to kind of think in a different way, or kind of go a different direction than like a traditional model of treatment that we're used to, because every patient is different, right? We can't treat them like they're all the same, because they're not. Everybody has different requirements and different like mechanics of their body, and just all these different factors that come into play. So it's really helpful to be able to kind of just experiment with things and be okay with it if it doesn't work out. And I wanted to show you guys too, so there's a few different ways. If you don't have thermoplastic material, or you don't know how to make a relative motion orthotic, or you don't have time or something like that, you can still use the idea or the theory of active redirection without actually making a splint for them. So there's a few different ways you can kind of incorporate that in treatment. Probably the easiest way that everybody can do, especially patients at home, without buying anything fancy or special, is just getting a pen, like one of these real small pens. That works the best, because it can be hard to shove a thicker pen in between people's fingers unless they're like really flexible. But you can use that for so many different types of patients, right? I've even started to give it to like trigger finger releases after their surgeries, because a lot of times they have kind of that PIP contracture and they're having a really hard time getting the fingers straight all the way. And so you can literally just put the pen in between their fingers, and you can have them exercise with a pen there. A foam hair roller or a curler also works really well because they're like soft, they're foam. You can pretty much get them anywhere, but if it's not for like a long period of time and you just want them to do some exercises with it, highly recommend a little pen. Let me take these hand masks off because I know I'm supposed to leave it for 15 minutes, but there. Let me show you this exercise. So let's say that this person that you are seeing had a trigger finger release on their ring finger, and they come in and they can extend their finger to about like 20 degrees or so. What you might give them on their first like hand therapy visit or their first post-op visit is a pen exercise, because everyone has a pen at home and it's easy to remember. And then you want them to slip the pen over the back of the middle and the ring finger underneath the pinky and the index finger like that. And then they're just gonna make a fist as much as they can, and then they're gonna straighten the fingers as much as they can. Yeah, so you can see the mechanical advantage is going to be a lot better, and they're going to be able to actually extend the ring finger a lot easier. You can actually use relative motion for both extension and flexion. It just depends on the way that you position it. So if I were to flip-flop it and position it this way, it's easier for them to flex. It gives them a better mechanical advantage to bend the PIP joint. So it just depends on like kind of what goal you're trying to achieve. So that's flexion again. Flip-flop it for extension. This is a really good exercise. I hope you guys use this. If you do, let me know. Comment below with any comments, concerns, questions, or with any cool outside the box kind of exercises that you've tried or therapeutic intervention that you've tried with your patients. I hope you guys enjoyed this video. Thank you for letting me just sit down and chat with you, and I hope you have a great rest of your day. Thank you guys so much for watching.